Our next speaker is Longxiang Li. Dr. Li is a research associate at the Harvard T.H. Chan School of Public Health. Dr. Li has worked on the health effects of living close to UOGD wells for over 5 years. He's currently funded by the National Institute of Environmental Health Sciences to improve the assessment of residential exposure to unconventional oil and gas activities. Dr. Li?
Thank you for organizing and inviting me to give the presentation. I'm Longxiang Li, currently working at Harvard on the health effect of fracking. And today, I'm going to talk about our recent publication, which has been published earlier this year, but it has been completed almost 2 years ago. So you see the study period is a little out of date, but I don't think the effects change a lot. As summarized by Dr. Diesel and Gonzalez in the previous session, in the past decade, there are there are tens of studies investigating the health effect of UOGD, or we call it fracking. And most of them, all of them, use the observational or epidemiological study design, which is not perfect, but that's the only way we can do now. There's a common limitation is the exposure side, that if you pay attention to all the studies, they use proximity as a surrogate for the exposure. As mentioned by Diesel and Dr. Diesel and Gonzalez, no, that's not best exposure assessment because it doesn't include the mechanism, the exposure mechanism, because the distance can mean a lot. People living closest to the fracking wells, they are more likely to get a royalty. So that can mitigate some health outcome, and the distance obviously misleads that. What's more, as I mentioned, royalty is part of the socioeconomic, which is perhaps the biggest enemy of observational studies, because it's both correlated with the exposure. That means people living in a higher concentration of the environmental agency, and they're also getting better paid, so that can help them live a little better. This type of correlation with both exposure and outcome can sometimes complicate the interpretation of the outcome. That's why in the previous studies, we are crazy to collect all the potential confounders and control for them in the regressional analysis. That's the motivation of our study. We try to address this limitation a bit. Let's highlight our research question. The first is to investigate another health outcome. That's the all-cause mortality in the Medicare beneficiaries. And what's more, as I mentioned, I want to improve the current cutting-edge proximity-based exposure assessment method. Our study period is from 2001 to 2015. The study extent, the region, is all the counties above the major shales, which is defined by the Energy Information Agency. That's why our study is perhaps the largest up to date. The study populations are the beneficiaries living within the study region. Our study design is cohort, and we got our UOGD, the fracking data from the AMROS, which is a third-party data provider, which supports not only our study, but also for the government monthly energy report. That's why we believe that the information from them is reliable. From the exposure assessment side, firstly, we don't have the street address of all the beneficiaries because that's too controversial. We only get their zip code. In some cases, especially in the Western United States, the zip code can be pretty large. And to use zip code directly as a spatial unit has been criticized by industry a lot, because that can mislead, that can increase the risk of exposure misclassification. So we take the population density into consideration. To take the Washington County in Pennsylvania example, even though most of the wells are around the downtown area, but the downtown area people are mostly residential, So we use the population weighted method to try to mitigate the misclassification. What's more, we take the wind direction to differentiate the people living downwind and upwind the fracking wells. That means take two people example. People A living 5 kilometers downwind of the fracking well. People B living 5 kilometers upwind of the fracking well. Do you think the health outcome are the same for both people? If they're the same, it's safe to say that maybe there's no wind-dependent difference, but there's some difference in the health outcome. Something must happen in the air pollutant emitted from the fracking well. We fitted two statistical models. The first, we only controlled for the proximity, that's the distance of fracking well. In the model 1, we want to find whether there's some distance decay in the health outcome. And model 2 is very similar with model 1. The only difference that we separate the distance dependent group into two subgroups. One for the person A, the same distance, but he lives in the downwind side. The second is for person B in the upwind side. We want to see whether there's some distance dependent trend and some wind dependent difference in the mortality effect. Here's our results. In the panel A, from left to right, low means low PE, that's low proximity. And it's a little complicated. That means people living pretty far away from the fracking wells. And on the right side is a high PE, that's high proximity. That means people living pretty close to the fracking well. And the y-axis is a hazard ratio. That's a health outcome we are trying to investigate. You can see from far to near the fracking wells, the mortality rate goes up. It's a very uniform trend. And in the panel B, we try to divide a distance group into an upwind subgroup and a downwind subgroup and re-estimate the health effect. And found that for the high PE, that's on the right side, high PE, that's the people living closest to fracking wells. The triangle, the black triangle, is the health outcome in the downwind side, and square is the health outcome in the upwind side. You can see there's some difference, but the difference is not that big. But if we move a little farther away from the fracking well, that's the medium high PE. That probably means that approximately people living 1 kilometer away from the fracking well, the wind-dependent difference is very obvious. The downwind side has a higher mortality effect than the upwind side. If we move a little further away, upwind has a lower health outcome than the downwind. And if we go further away, that's probably about 10 kilometers away, no difference anymore, because air pollutant cannot travel that far away. At least for the air pollutant emitted by the fracking well, they cannot go that far away. If we put them side by side, you can imagine that. Because air pollutant cannot travel against wind, they can only travel downwind. That means the decay in the health outcome is smoother in the downwind side compared with the upwind side. We can put that in number. The high P group, which is on the bottom, DE minus means the upwind side, that's downwind exposure, but it's negative, that's the upwind people. And DE plus, that means the downwind exposure, but it's positive, that means people living downwind. If we compare them side by side, we can find that the p-value is much smaller than 0.001. That means there's a significant difference in the health outcome from downwind and downwind and upwind. I mean, not all the proximity are the same. Downwind proximity seems more harmful than upwind proximity. This is only part of our study. We have done tons of sensitivity analysis to prove that our results are robust to a lot of assumptions. As introduced by Dr. Willis, in my previously. The DID design is special. It has better control for the unobserved confounding factors based on a little stronger assumption. It's the parallel trend. And we redid the analysis with the DID and found similar results. And we also try different brackets to separate the proximity and downwind upwind. We try a lot of different analysis and found very similar pattern. This is very similar with what Dr. Clark mentioned earlier. That's the minimal, the basic model that we didn't control for a lot of factors. That we controlled for environmental factors, we controlled for the social intelligence factors. That's the maximum adjusted model. As more and more factors are put in the model, we can find that the left side, the panel A, the side panel A, the solid line are the final result. The dashed line means the results based on the basic or the lightly adjusted model. As we put more and more factors in the model, the results are closer and closer. That means the normal regression analysis are sensitive to the omission of key confounding factors. If we didn't control for these factors, confounding factors, then we get some misleading results. But the wind-dependent difference is significant no matter what we control for. If we only control for the individual level covariate, the wind-dependent difference is still there. That means wind-dependent is relatively independent of social economic, it's independent of environmental factors. That means if people determine where to live, they may pay attention to the distance to the fracking well, especially considering the overwhelming studies saying that living close to fracking well are harmful, but they may not pay attention to the wind direction. And we divided our study into small 3 sub-regions, not only in Pennsylvania, but in Dakota and Texas. We found similar but different patterns, which makes sense. If we found the same pattern in 3 regions, that may be, the result may be manipulated. Real life is much more complex than a model. So the taking away point, living closer to fracking well is harmful, especially for Medicare beneficiaries. Yeah, they're going to have a higher risk of mortality. Living downwind is more harmful. And the wind-dependent difference of the directionality in the health effect indicates that air pollutant emitted from the fracking well likely play a significant role in the mechanism. As I mentioned, our study is perhaps the largest study up to now, and the first study is trying to investigate the exposure mechanism. Our study is funded by EPA and NIH, and if it makes you happy, it's funded by them. Otherwise, I don't know who funded them. And our study has been published earlier this year. I'd like to address all the questions. Thank you for your time.